Hi, my name is Leanne Ludwick, and today I will be speaking to you about our study. Aspirin may be a suitable prophylaxis for patients with a history of VTE undergoing total joint arthroplasty. First, I'd like to thank JBJS and my co-authors at the Rothman Institute, especially Dr. Parvizi, for the opportunity to speak about our study. We were first inspired to conduct this study because there is a commonly held belief that patients who present with a higher risk of VTE, such as patients with a previous VTE, require more potent anticoagulation. However, there is little data to support this practice. Potent anticoagulation carries a higher risk of bleeding, and therefore the benefits of their use need to be weighed against the risks. In recent years, several studies have emerged showing the great efficacy and safety of aspirin as VTE prophylaxis, including its use in high-risk patients. However, the use of aspirin in patients with a previous VTE has yet to be specifically evaluated. As a result, we are motivated to determine whether aspirin is a safe and effective VTE prophylactic agent in patients with a prior VTE. The biggest limitation of our study is the low sample size of patients with a history of VTE who were treated with aspirin postoperatively. This is largely due to the assumption that patients with a higher risk of VTE require more potent anticoagulation than aspirin. Stepwise regression and propensity score analysis were then utilized to remove the potential bias of confounding variables and effectively compare the aspirin and non-aspirin groups. The most important finding of this study was that aspirin is indeed a safe and effective prophylactic agent for patients undergoing total joint arthroplasty with a history of VTE. This finding has important implications for the orthopedic community. It highlights the potential of adopting aspirin as the anticoagulant of choice in patients with a history of VTE undergoing total joint arthroplasty. With other studies in the literature highlighting not only aspirin's superior safety profile, but also its utility in high-risk patients, it is important to consider a potential change in practice. We believe our study provides impetus for future research to assess aspirin's efficacy in these high-risk patients through larger multi-center studies and randomized prospective trials. Overall, we want to continue thoroughly evaluating the role of aspirin in patients with a history of VTE undergoing total joint arthroplasty. Thank you.